I'm honored that our next speaker said yes when I asked her. She is the current president of the American College of Lifestyle Medicine. She's also a professor at Harvard. She teaches lifestyle medicine there. And yeah, I think she's going to be visiting us via Zoom right now. So if we can get her connected, that would be perfect.
Okay, wonderful. Thank you so much for having me. And I am so sorry I couldn't be there in person. My schedule just didn't allow it, but I'm delighted to be able to share with you by Zoom. So we are going to talk about health and wellness coaching in the day-to-day practice. Who, what, why, when, and how. As you've already heard, I'm a clinical assistant professor at Harvard Medical School in the Department of Physical Medicine and Rehab, where I've been since 1996 and really started my journey in lifestyle medicine in 2008 at Spaulding Rehab Hospital and the Institute of Lifestyle Medicine. And so honored and delighted now to be serving as the president of the American College of Lifestyle Medicine. You do have a couple disclosures on the Scientific Advisory Board of Jenny Craig and Obvious Solutions, as well as Medical Advisory Board of Clearing.com. Together in our half hour, we are going to answer the question, what is coaching? Some of you may be a coach, and some of you may be hearing about this in detail for the first time. Likely you've heard about health and wellness coaching, though. When I started in 2008 and I became a certified coach, one of the first physicians to do so, most of my colleagues did not know what I was talking about. They didn't hear about a health coach or a wellness coach. And as you'll see from this presentation, we now have national certification in health and well-being coaching. So I'm going to share with you what I've learned in the past 15 years or so, taking 3-4 different health coach training as well as motivational interviewing certification. I'm going to try and condense that into our 25 or so minutes together. So I'll share with you a mnemonic. I hope you can utilize it. If you're already a coach, you may guess what this coach mnemonic stands for. And then we'll explore a little bit of the literature. This is evidence-based, as lifestyle medicine is. And I'll share with you a 5-step collaboration cycle for doing coaching. So if you are unfamiliar with the process, you'll leave here with a 5-step cycle you can experiment with and try when you get back to your clinic. So it's going to be the science and art of behavior change. We just had a lecture on nature and we have some growth here. Always interested in growth and learning. We've had lots of opportunity to do this in the past 3 years, and certainly my coaching strategies and techniques and platform have changed since COVID and things have gone virtual. I need to start from the beginning, and that's going to help us to see the why, the who, and the when of coaching, even some of the how here. So many of you are here today in this room, your primary care physicians, maybe some specialists, health and wellness coaches perhaps could be in the room, healthcare providers of all different types. And mostly we come into this area of service and this profession, healthcare, for particular reasons. A lot of times it's a patient. And in my case, it certainly was a patient, this gentleman here, who's given me rights to share his story. He's 72 in this photograph. I'm going to bring you back to a time when he was 52 years old. Of course, I can't see everybody. I can see some of the people on Zoom, but I can't see everybody. So I don't know if you're yet 52, or maybe you know someone who's 52, or you've passed that. So this gentleman's 52 at the time of this story. Overworked, overweight, overstressed New York City businessman who dined almost exclusively on fast food. He ate fast, walked fast, talked fast, and did a lot of it all at the same time. And anything that was on the corner of New York City was fair game for him, and he only really ate well going from here to there. Or when he was stressed, he would have candies in his middle drawer to help him relieve his stress. There was a lot of stress because he took over the company from his dad. So he really wanted this business to work. In fact, it consumed him. So although he did have social connections, he was married with children, his work was his whole life. So you may know someone like this, really overworked, overstressed. And if you think about sleep, another pillar, it wasn't really happening. He would potentially try to go to bed at midnight, but he would wake up, go to the kitchen, eat any sweet that was there, maybe check out the freezer for ice cream, jot down a few notes for the clients in the morning, and then try to go back to bed and wake up at 5 to get back in the office for 6 o'clock. Now, another one of our important pillars is exercise. And this gentleman did nothing, sedentary, sat at the desk. He was a financial advisor, so he was crunching numbers pretty much all day, sitting all day. Despite the fact, actually, he was an outstanding athlete when he was in high school and college, soccer player, baseball player, basketball player, but at this time wasn't doing anything. That's not actually entirely accurate. He was doing one thing, and you never knew which day he'd do it, but you definitely knew what time he would do it. He would do it at 11:07 p.m., this exercise. And I wonder if you can guess what this exercise is that he would do sporadically, but at 11:07. So some of you probably know, but I'll share. He would sprint, mad dashes. I mean, complete full-on sprints from 101 Park Avenue to Grand Central Station to catch the last train home. And on one of these sprints, he got a little pressure, a little pain, no gain, forge forward, made the train. Your healthcare providers, you can guess what happened in that half-hour trip. Elephant resting on the chest, numbness and tingling down the arm, diaphoretic, short of breath, pale. Wife picks him up. She's a school teacher, takes one look at him and takes him to the local ER, where he completes his massive myocardial infarction and his right middle cerebral artery infarct, leaving him paralyzed on the left side. So this is a story that is pretty common. See this a lot. I trained in physiatry, saw a lot of stroke patients, and a very common story. Some of you may know someone that has a similar lifestyle, maybe someone that had a similar outcome. I know this story so well because that gentleman is my dad, and that happened when I was 18. I'm pleased to tell you he made a complete recovery except for fine motor movement of his left hand. And he did make a complete lifestyle change. So did I when I was 18. So this was in the 80s. Fortunately, there was Pritikin centers at that time. And he and my mom went to the Pritikin centers, and where they were there for about 12 days and learned how to eat healthy. He got back into exercise, and he learned about stress reduction that didn't include eating, and that didn't include yelling, and was more about movement. And he got back on his stationary exercise bike 5 times, half hour each time, every week. And his plate looked completely different. Suddenly there was kale, there was lettuce, there were vegetables on our plate that I'd never seen before. We didn't have salads before this time. So everything changed, and he really had the best 27 years of his life. Now, people can change like that. I realize looking back at it now, my mom was very much a coach to him. Was not health coaching back in the 80s. I'll share when it really started and got going here in the US. It's closer to the 2000s and had some traction in 2010. But back then, people were lucky if they found a Pritikin center. So when things like this happen, people are ripe for change. Some people change just because of this. Some people change for the fear of this, like me, like people who get a diagnosis of high blood pressure, they want to change right away, or diabetes. A lot of people, though, need a program. They need time. They need coaching to make that change. I used to think it was just knowledge. Knowledge is power, Sir Francis Bacon. And my chairman, Dr. Ross Safont, chair of physical medicine and rehab here at Harvard, I told him I wrote a book called How to Prevent a Stroke. And I said, I'm going to study the people that read my book and I'm going to see if they make any changes. And he said, that's actually a waste of time, Beth. Don't bother doing that. Instead, study behavior change. And you'll see it's a lot more than reading a book. So I credit him for giving me the inspiration to launch into health coaching and behavior change work. Share with you now. So health and wellness coaches, this is an official definition now from the National Board of Health and Wellness Coaching. Health and wellness coaches partner with clients seeking to enhance their well-being through self-directed, lasting changes aligned with their values. In the course of their work, health and wellness coaches display an unconditional positive regard for their clients and a belief in their capacity for change, honoring the fact that each client is an expert on their own life, while ensuring that all interactions are respectful and non-judgmental. Interestingly, the American Medical Association got in on this as early as 2013, and they have been using it. What is health coaching by their definition? Health coaching can be defined as helping patients gain the knowledge, yes, but not only knowledge, the skills, the tools, and the confidence they need to become active participants in their care so that they can reach their self-identified health goals. The familiar adage, give a man a fish and he eats for a day, teach a man to fish and he eats for a lifetime, demonstrates the difference between rescuing a patient, and coaching a patient. For chronic conditions, patients make the salient decisions every day. What will I eat? Will I exercise? Will I take my medications? Patients with chronic conditions need to learn how to fish. They're making these decisions every day on their own, not in our offices. So, interestingly, I went back and looked at the literature for coaching and was surprised to find the first article published in PubMed was in 1892. Health coaching, a developing field with health education. Well, you can see how the literature has exploded over the years. In 1990, there were 12 articles. When I came into this area, there were 485 articles in 2010. Now jump 10 years later, a decade, 2020, 2,143 articles in health coaching and health outcomes. 2022, 2,656. This is a hot topic. And that's why we needed some credentialing, some certification, some standardization. So we would be able to study health coaching and also be able to provide it in a consistent way. And enter the National Board of Health and Wellness Coaching. You can learn a lot more about coaching on this website. And there really is the how and the art. There's science and there's theories that are well known. Trans-theoretical model of change is one. Social ecological model of change, another. You may be familiar with these. And we use them with coaching. Use a lot more than that too. And in terms of the credentialing for health coaching, this article from 2015 goes over best practices and, again, standardization of training and credentialing for that national certification. There are 38 skills from the job task analysis of health coaches. I'm just going to call out a few here. Displaying empathy, motivating for behavior change, enhancing self-efficacy, the belief that the patient can do it. They believe in themselves. Goal setting, critical. Behavior tracking, these are all essential. All 38 are essential skills for people to master to become a certified coach. Building autonomy cannot be forgotten. And sometimes when we're in the expert approach, we forget everybody wants to have control of their decisions, right? Self-determination theory, another psychological theory that health coaching is built upon. We need competence, we need connection, and we need autonomy. So we cannot forget the patient wants choices and they want to choose. Now, you may be a health coach. You may be interested in pursuing, learning about behavior change and health coaching, or you may decide that you'd like to work with a health coach, and you can find coaches on that website I just shared. I want you to know that there's category 3 CPT codes for health coaching. They're listed here, 0591T to 93T. I was just part of a group with the National Consortium of Health and Wellness Coaches, several of the leaders, Margaret Moore, Leanne Webster, Jessica Matthews, a lot of others came together over years to try to move the CPT code 3s to CPT code 1. We just had the panel with the AMA a couple weeks ago. Unfortunately, we did not succeed in going from category 3 to 1, but the battle is not over, and we learned, and we're going to forge forward and hopefully get that to CPT 1 coding. So that's the latest update there. If this is new to you, or if you're a coach, I'd like you to just review the difference between the expert, which is the physician's agenda, healthcare professionals' agenda. We're trained in this in this expert approach in healthcare schooling. And then I want to share with you the difference when we have the coach or the client's agenda, which is what we work with in behavior change. So first of all, we're taught in our healthcare professional training to treat the patient, to educate the patient, rely on our skills and our knowledge as the expert, strive to have all the answers, focus on that problem, solve that problem, and advise the patient the best way forward. And we need this, especially someone who comes into the ER like my dad, right, with a heart attack and then a stroke. They need this expert approach. Now, later, when he goes back home and he's recovered and he's wondering what he's going to do about his chronic condition with high blood pressure and high cholesterol, then we need to get the coach approach in here. Help the patient help themselves. Build motivation, confidence, and engagement. Rely on patient self-awareness and insights. Strive to help patients find their own answers. Focus on what is working well and collaborate. That's the key. This is collaboration and negotiation with the patient. The patient is the partner. That's the fun too. So here's the mnemonic. When you're thinking, this is a patient that has a chronic condition that needs behavior change, I must change my attitude in this counseling session and get a coach approach attitude. You want to be open and curious. Open meaning non-judgmental. You want to appreciate any movement forward, any inclination that they have to start having that kale or lettuce, or to start moving more and sitting less. And then compassion. And of course, honesty. And when you don't know the answer, you explain you don't know the answer. And if they ask you if some crazy diet is okay, of course you have to answer honestly with the data and the literature. So this is the coach approach, and I do talk about this in the Lifestyle Medicine Handbook. Oh, my dog is joining. Sorry about that. In the Lifestyle Medicine Handbook, I want to talk to you about the fun of coaching and being in these partnerships and how you use your whole brain, the social brain. You use your amygdala, your fusiform that's identifying feeling in someone's facial expressions. And then medial prefrontal cortex, superior temporal sulcus, that's going to help us with mood. Visual and auditory cortex, obviously we need to process sights and sounds, and we need to listen, do a lot of listening when we're coaching, less talking, more listening. And when do we do this? Basically with any patient that has chronic conditions, that is at risk for chronic conditions, that's working on behavior change. When you see an opening to have a conversation with a patient about all the 6 pillars of lifestyle medicine, exercise, nutrition, sleep, social connection, stress reduction, avoidance of risky substances, this is when you take that opportunity to use the coach approach. Now, I mentioned there's science. Again, we only had 25 minutes together, so I'm going to share with you quickly and allow you to evaluate on your own some of the literature, but it's there. So this was the literature from 2015 showing 16 randomized controlled trials. When I first looked into this in 2008, there were about 8 randomized controlled trials that were rigorous that we could look at and maybe have a meta-analysis of. And at that time, and we still are here in terms of, we want the interventions on health coaching to have clear definitions of what the health coaching is. Now you know if it's a certified coach, you know how they were trained and you know their process because we now have the certification nationally. And then we need consistency in reporting the behavior change techniques. What did the coach do and how many visits did they have? How long were their visits? So we can really quantify this. We're looking, of course, to get clinical practice guidelines. We need some meta-analyses and some systematic reviews. Randomized controlled trials, we need more of these, cohort studies, case controls, even case reports. So if you are coaches out there, share your case reports. It's a call to action for you today. Here's one that you can look into. It's one of my case reports in the BMJ from 2016, Lifestyle Medicine Consulting Walking Meetings for Sustained Weight Loss. And I talk about what strategies I use with this patient over the 2.5 years. That's the other thing. We need longitudinal follow-up. We need to watch and see what happens over years with people after they've gone through coaching, one-on-one or group coaching. So we need to, again, be specific about our dose, how often we're seeing the patients, what the results were, and how we maintain. So there's adopting and then there's sustaining. And health coaching allows us to do both. And engagement is key. I did mention and emphasize randomized controlled trials. I was working with a group that looked at all of the literature in health and wellness coaching. So the cohort studies, the case studies, all of the literature, and we made a compendium and put that in the American Journal of Lifestyle Medicine in 2018, and noted that there were improvements in primary outcomes like hemoglobin A1C, in risk factors, in psychological profiles. These are all seen in the clinical populations of cancer, diabetes, and heart disease patients, where most of this literature comes from for health coaching. Shortly thereafter, in 2020, we updated and added 104 peer-reviewed coaching articles and found similarly that health and wellness coaching can have positive effects on cancer, cholesterol, diabetes, heart disease, hypertension, obesity, and wellness, again, in the American Journal of Lifestyle Medicine. Since there have been several studies that have been reported out, and I'm giving you here a list, and in your references, you'll be able to look through these, of different studies that have shown health coaching to have an effect on physical activity, dietary behaviors, management of stress, health responsibility, a lot of our lifestyle medicine pillars, improved well-being based on physical criteria. This is for aging workers. In chronic disease coaching, there were 9 studies, and we're looking at the best methodology. Here, it was preferred face-to-face. I'd like to see what happens in 2023, since most of us have been doing virtual coaching since the pandemic. Now, not all studies are positive. Some studies are not showing significant outcomes, so we got to keep watching the data. Somebody to look out for is Ruth Welliver, who's been in this space for a long time and been in health coaching research as well as training. She did the training for Duke, and now she's at Vanderbilt. And she noted that in coaching operations, when you look at all the different coaching studies, it's patient-centered, patient-determined goals, self-discovery. It encourages accountability, provides education and coaching, just-in-time education, and not just education. And then there's a consistent ongoing relationship. I talk about her because she is someone that continues to push the field forward. Here is her article with her colleagues about a health coach assessment tool. So you can check to see if what is going on in the counseling session is consistent with health coaching. So there's long-term vision casting with health coaching, designing goals, action, and self-monitoring. There's a use of self-discovery process, matching information to client interests and needs. And then there's this client-centered mindful approach. The physician, the coach, needs to be fully present and mindful. All the senses ready to go with that social brain firing up so that they can really connect with the patient. Again, check out Ruth Welliver in this article. We'll share with you some highlights of it. So for long-term vision, designing goals, actions, and self-monitoring, you need to explore what the client wants. Remember, this is all client-centered in coaching. Designing these long-term goals, short-term goals, and action steps, which are SMART goals. Accountability, self-monitoring, and problem-solving are key. We do use self-discovery in coaching. What are the patient's values? Explore different perspectives. Elicit learning and insights. Use the growth mindset from Carol Dweck, meaning mishaps are opportunities to learn and grow. Amplify positive resources. So it's matching information to client interests and needs. We know that we educate the patient. Yes, in coaching. Yes, when we're counseling. But this is sharing information with the client that is applicable to them and checking in. Remember, autonomy. Would you like to hear about how your diet could change your blood pressure? Just like a medication. Yes. Oh, yes. I really want to hear that. Okay, great. And then you can launch into it. And then you check in and say, what did you learn from that? What resonates with you? Now, this is really, really important. And it's talked about more and more with coaching. Client-centered, mindful approach, taking that mindful moment, fully present, be fully present when you're coaching. Collaborative, support autonomy, express empathy, invite session focus. You use open-ended questions. You're listening more than you're talking when you're coaching. Sometimes when we're the expert approach, we have to talk more. We want to get a lot out. We need to problem solve. We need to share. We need to advise. In coaching, it's expressing the empathy and it's the active listening. So you're more silent than you are. And you're supporting that autonomy than you are when you're in that expert approach. So here we go. We're going to end with a 5-step cycle, and we're going to put this mindful moment in. So before we go into the room, before we coach, before we counsel, we take deep breaths. Now, this is harder, and it's not just a few moments before we go into the center, into the counseling session. We need to think about our own self-care so that we can be fully present and there. So that takes time, and that's those 6 pillars applied to ourselves. So here's the be empathetic. You know where this comes from, the research. Align motivation, build confidence, set SMART goals, and set accountability. The practice of attunement to bring into harmony between 2 people, you and the coach, or if you're doing it in group, you and the patient, if you're the coach, and if you're doing it in a group, you and perhaps 12 other people. So harmony, it's not just a solo. You're not the one talking all the time. You're listening and responding. So why empathy? We often refuse to accept an idea merely because of the tone and voice in which it has been expressed is unsympathetic to us. Research demonstrates that empathy can increase patient satisfaction. This increases connection and increases the likelihood of follow-up and engagement, which we need. So this motivational alignment, this is all about motivational interviewing. And I recommend this book, Motivational Interviewing, Helping People to Change. Motivational interviewing itself, collaborative, goal-oriented communication style, particular attention to the language of change, designed to strengthen personal motivation for and commitment to a specific goal, not the physician's goal, not the coach's goal, but the goal of the patient, by eliciting and exploring the patient's own reasons for change within an atmosphere of acceptance and compassion. So we need to build confidence. How do we do that? We ask people what their strengths are. Think about a time when you were at your best. Tell me about it. This could be a coaching question you can use to help build confidence. When did you achieve a goal you were striving for? What strengths did you use? How can you apply those strengths now? These are questions you can ask to help in that step, that 3rd step. Now, I ask, what are your strengths? A lot of people don't like to answer that, or they're uncomfortable. So then we go to these 2 and 3. So specific, measurable, action-oriented, realistic, time-sensitive goals come after we listen to the patient, we understand them, we align motivation, we build confidence. You don't just jump into the goal setting. And you know about being specific, not just I'll exercise more. On Monday, Wednesday, and Friday, I'll take walks after dinner with my partner for 20 minutes, something very specific that you can put in the calendar. And I want to share, let's make these goals in alignment, in attunement with their values, their vision of themselves for the future, their own priorities, their purpose. So research shows heart failure patients, they're more likely to follow through with the goals if those goals are not just about diuresis, if those goals are related to their life's purpose, their values. So then after you make goals, you can't just set them free. You need to check up. You've heard this from the founder of modern management, I'm sure. What gets measured gets managed. So there's so many ways to log, and everybody's got different devices. Some people have 3 different wearable devices, but others like to log, pen and paper. So you just have to ask, and it depends what the goal is, but you need a way to measure. And that just brings us right back to our 5-step cycle, because after setting up accountability, you set empathy. So when they come back to you in the next week or maybe month, depending, you go back to square one, step 1, be empathetic. What is the goal, overall goal of this 5-step collaboration cycle in coaching? That person feels understood, motivated, supported, engaged, and has hope. That's the coach approach: curiosity, openness, appreciation, compassion, honesty. And that's the heart and soul of coaching. And hopefully you can get to that heart and soul. You get to that through this coaching and through this listening process. And that ends it today with me. I'll be back tomorrow. But the summary is behavior change is key to the practice of lifestyle medicine. It is the secret sauce. It's evidence-based. Try the coach approach, the 5-step cycle of change. Enjoy the process. And it is a journey. The whole thing for you, for your patients, for your practice. So thank you so much for the time. I really appreciate it.
Thank you, Beth. Wow. Okay. So I will just say that when I did my certification in lifestyle medicine, motivational interviewing was huge on that test.
Yes.
You really do learn and you're able to do motivational interviewing. And this is not only good for your patients, but it's also good for your life. It's really cool.
For your kids.
Yeah, yes, my kids, definitely.
Yeah, with your loved one and even your parents.
Yeah. No, and so we have actually figured out, our AV guys have figured out how to do a Q&A with Beth if you guys have a couple of questions for a couple minutes.
Wonderful.
Yeah.
I see something in my chat. I don't know who can see this. Is there a crash course on how to learn the coach technique? So, yeah. Don't know about a crash course, but I do love that motivational interviewing book. So that's a quick read. Okay, edition 3 is a thick one. You could read, if you're taking a plane ride home that's 3 hours, you could read edition 2 on that plane ride, and that would be a nice crash course, motivational interviewing by Miller and Rolnick. I guess I'm a little partial to the 2 chapters on coaching that are in the Lifestyle Medicine Handbook, only because I hope they're helpful. So those are things you could do now immediately. But here's the deal with coaching. As you know, I started in 2008. It's all about the practice. It really is. You've got to practice it. I practiced on my mom first. I practiced on my kids. I practiced on pretty much anyone. And what I practiced was listening, because obviously I talk. A lot of us like to talk and share information and give advice and tell people. So it was hard for me to stop that, to stop talking and just ask an open-ended question and literally just listen without trying to jump in and fix it. So this would maybe this is the graduate course. Work together today and tomorrow with someone. Ask them what they'd like to change about their lifestyle and listen. Don't jump in with the answers. Just listen and then say, how do you think you may do that? What are some options for you? And let them tell you how they might change the thing they want to change, and just practice those 2 questions together. That might help you.
I have a question.
Are there? Yes, please.
Yeah.
Yes, I feel as a physician we coach every single day, but my concern is we have a 10 to 15 minute appointment, and it is so hard to get into the deep levels and really motivate people to make change when you're rushing all the time. Do you have any suggestions on what we can do? I mean, with overhead and everything, a half hour or 45-minute appointment is not feasible. And
Yeah.
I feel that I want to help my patients because they're, I share a lot of my experience because I'm a heavy girl and I have a lot of, health issues. And honestly, I think that motivates them a little bit, knowing that I get up at 5 o'clock and swim every day and that I can do it, and I work 80 hours a week and I can do it. And they always say, I don't have time. I go, I know what you're feeling. What can we do to, motivate them in a short period of time?
Well, first of all, unfortunately I can't see you. I wish I could, and just tell you that is fantastic. So you may or may not know you're doing Erica Frank's work that she studied back in the early 2000s, where as a physician, if you disclose what you do, in fact, she talked about having an apple and a bike helmet on the table when the patients would come in, and though she tested if there's a video of a physician saying, I know it's hard to eat healthy, I bring this apple in as my snack, and it's hard to get in the the exercise. So I bike to work, just that short, very, very brief interaction. And then another interaction in a video that said, you really need to exercise more and you really need to eat more fruits and vegetables, same amount of time. And of course, this physician who behaves like you in that video was far more motivating when rated by the patients in the study. So first of all, you're already following the evidence-based guidelines, number one. Number two, I hear you. One thing to think about is group visits. I don't know if you're familiar with these. Well, I'm going to talk about them a little bit tomorrow when we're together to talk about how physicians can help create healthy communities in the hospital for themselves and for patients. So when you have one patient, I don't know if you know about this, shared medical appointments, one physician, 12 patients. So when you're one-on-one physician-patient, that's right, you have 15 minutes. But if you can get one physician, 12 patients together in the room, and there's billing for this, CPT coding that you can do for this, as long as you have the one-on-one encounter during the hour group visit with 12 patients. You may find this way of practicing to be refreshing, to be satisfying. The results and research show that patients like this way of practicing, they feel they get more from the physician, and physicians feel also more satisfaction. So this is one idea, but I would like for you to think about, because that will take time and you want to train in that, and something, how about partnering with a health and wellness coach? Could you do that with your practice? So you could set them up to then meet. You could have the interaction, ask the open-ended questions that you can do in that brief period of time with your patient, right? You only have the 15 minutes, maybe 10. And then you can set them up with a health coach who can follow up in between. Does that help?
Yeah, she said yes.
Oh, I'm so blessed.
She's coming.
Yeah, I appreciate that. And I think that would be good, but I have a really hard time charging a group people. I mean, I would do it just, at the end of the day. I mean, we had a group called Women in Emotion, which was a group of older, fatter, unhealthy people. And we got together as a group, and we more or less met 3 times a week, and our goal was to do the Ogden Marathon. And we started in January. By May, we did a half marathon, and half of us just walked, but we did it. And we got a group of women that basically have met since then, and that was 10 years ago. And it still motivates us to keep going. So, we're all working on helping everybody, and we would be wonderful if we were all a size 6, but we're not. And so I just think we have to help each other. So thank you.
That's a great story, and that could be a great case. That could be a great case demonstration if you wanted to pull it together. But I do encourage you to do SMAs, shared medical appointments, where you can do it through CPT coding so you can get paid. I don't like thinking of you at the end of the day exhausted, and again, giving of your own time and yourself with these other groups, which are powerful, I agree, but I would love for you to work on the shared medical appointment model so that you will get compensated. And you can now. It has grown and developed such that you can run these groups and get compensated. You could reach me, email me if you'd like, and I could get you connected. Every insurance company, it's a little different with different hospitals, but I can connect you with people that perhaps can help set you in the right direction.
Great. Thank you. Thank you so much, Beth. Well, okay, we are excited to hear from you tomorrow. Thank you so much for being here and giving us of your